Hello friends, my name is Dr. Saab and welcome to my YouTube channel. And today we are going to talk about an important topic which is often asked to me by many of my colleagues, how they can come to Gulf. This is the first question. And second question, they ask why they should come. So obviously they are already motivated, but they want to know why they want to come to what are the opportunities here for growth and how is the infrastructure, etc. So today in this video we are going to talk about the qualifications, how to come, what should you expect in Gulf, and what are the benefits, how is the life, everything we will discuss in this video. So you should watch this video till end. And my name is Dr. Saif and I'm a critical care medicine consultant in the University Hospital in Bahrain. And this is my small introduction, and let's start this video. So the Middle East, specifically the Gulf Cooperation Council countries like Oman, UAE, Saudi Arabia, Kuwait, Bahrain, Qatar, these six countries represents a highly lucrative and professionally rewarding destination for Indian doctors holding MD or DNB degrees in anesthesiology and critical care. There are multiple macro benefits for Indian doctors in Middle East, which include the high financial reward, world-class infrastructure, structured career environment, advancement for Indian doctors, especially those in critical care anesthesia. So the first one is the tax-free salary and comprehensive benefit packages that significantly outpace average earnings in India. That's first and foremost reason why they want to come to Gulf. Second is the state of art, near perfect environments where you can work, characterized by massive state investment and Western standard technology. You will have access to advanced equipments like ECMO, echocardiography, CRRT, cardiac output monitor. So, unlike the high volume pressure of many Indian hospitals, the Gulf often features strictly regulated patient to doctor ratios. So you will not be overloaded too much by patient load and clinical work, and it contributes to lower burnout levels. ICU specialists are highly valued within a structured hierarchy. So we'll talk about that later. Then we have a major macro driver is the massive investment in healthcare infrastructure across the region, most notably Saudi Vision 2030, and this unique initiative is creating urgent vacancies for ICU specialists and intensivists to staff newly developed state-of-art medical facilities which are continuously being constructed. Then the last one is the fast track growth. The region is not just a place for clinical work, but a hub for leadership and specialization. So anesthesia background are highly valued for ICU roles due to expertise in ventilation and hemodynamics, allowing for a rapid transition into critical care specialty. So somebody who is having a degree merely in anesthesiology with 2 years of experience in ICU are valued here, and they can be given the critical care jobs as a specialist. So the qualification matrix for Indian doctors in Middle East is defined by the Unified Health Care Professional Qualification Requirement, PQR. You should go and Google it to PQR. So this PQR categorized Indian doc degrees, MD and DNB as Tier 2 qualifications because they are not Tier 1 like UKCCT or US board certifications. So Indian doctors must follow specific pathways based on their super specialty status and years of experience to achieve their desired designation. So as you know, we don't have MD in critical care in India. So what they expect is the 2 to 3 years of experience in critical care apart from your MD anesthesiology, MD medicine. So if you have a PDF, for example, or if you have a FNB, or if you have a PDCC, all these super specialty diploma or certificate courses are valued to become a super specialist. What are the first we will talk about eligibility criteria. As I said, so candidates typically enter the Gulf network at the specialist level after 3 to 5 years of experience in critical care after MD. Specialists are responsible for comprehensive care of patients in various types of intensive care units, including medical, surgical, cardiac, neuro, and trauma ICUs, operating cutting edge medical equipment such as ECMO, CRRT, or will be there. And specialists work within a structured hierarchy, typically reporting to senior consultants while overseeing junior medical staff. And your role is also not just to do a clinical duty, but also to participate in various audits, to participate in education and research. Because Indian qualifications like MD, DNB, or DRNB are classified as Tier 2 qualifications, candidates cannot move directly into a consultant role without fulfilling a specific experience and subspecialty requirements. And there are two pathways for that, as you know. The good news is the ICU physicians and intensivists are high demand and consistently earn more than their anesthesia colleagues, even they share the same level of qualifications, experience, and rank in hospital hierarchy. So they have a little edge over anesthesiologists as far as the income is concerned. They will be getting little more, about 10 to 15% premium salary over pure anesthesia roles. So now we'll talk about the pathway 1, pathway A, the super specialty route, DM and DRNB. This is the most direct route for achieving consultant status for intensive care specialist. So a strict minimum of 5 years of continuous verified clinical experience practicing exclusively in the subspecialty after obtaining DM or DRNB. If you do not have that super specialty degree, you must first enter the Gulf healthcare system as a specialist to work for 8 to 10 years, apply to upgrade. Okay, so this is another pathway which you could think of, that if you have a MD, only MD or DNB in anesthesia, emergency medicine, or medicine, pulmonary medicine, etc. You can still think of, but little later, okay, to become a consultant. But first join as a specialist. The financial package for Indian doctors in the Middle East is indeed one of the most compelling reasons for relocation. So we'll talk about salary here. The salary is very attractive, starting from 24,000 AED to maximum 95,000 AED, which translates into up to 21 lakhs, okay, for the consultant. And for the specialist, it starts just 1/4, so you can get up to somewhere between 5 to 6 lakhs initially. This is also a very good salary. Very good salary actually, if you talk about other advantages also. So beyond the basic salary, as I said, you will get attractive benefits like housing allowance, health insurance, return tickets, flight return tickets for your family, for yourself. At the end of contract, end of service, you will get some more compensation, gratuity. And also there is some education subsidies included. Many premium private and government hospitals, they provide you school tuition fees allowances to help cover the cost of international schools for your kids, okay. In some places I heard they have also the compensation, little more compensation for your educational activities as a lecturer or something. So they will get extra pay. And also if you do some overtime, in some places they have provision to provide you extra salary for your overtime as well. Compared to UAE, you have little better pay in KSA, but at a cost of conservative culture and Arabic language proficiency requirement. So you must clear Saudi licensing exam in Saudi Arabia, and in UAE you have to clear DHA or HAAD exams. So these exams are basically licensing exam. So for Oman, Qatar, Bahrain, Kuwait, you have different licensing authority. So regarding the assessment of specialists and consultants in ICU, there is slight difference. So we will talk about that first. So for the specialist in critical care in Gulf, a prometric exam is conducted, which is fundamentally computer-based exam consisting of multiple choice questions focusing on core clinical competencies. So it's very easy. It can be cleared if you have a basic knowledge in critical care. So this is for specialists. And for the consultants, there is no prometric exam. Just you have an interview, oral viva, by a panel of experts who will assess the ability of candidate to manage complex ICU cases, ethics, leadership roles, etc. So you have to have a good documentation of logbooks of procedures done in last 2 years to 5 years. So you have to show what you have done in ICU. So you should have a record of that in the form of certifications, CMEs you have attended, the conferences you have attended. and you should be able to show the certificate that you didn't have any interruption in your career, and if you had an interruption, you should not have it more than 2 years. And you should have also certificate of good standing, which is usually provided by Indian State Medical Council, and it should be fresh. It should not be very old, like not more than 6 months. And all your degrees will be attested by Ministry of External Affairs in India, and the respective GCC country embassies. So what is the flow of employment? So apply through human resource agencies. So there are various agencies which frequently float the employment opportunities in the form of advertisement and WhatsApp messages and emails, etc. So through media you have to be in contact with them. So these HR agencies, which are few of them are listed here for your information, and should not charge you. That's very important. They should not charge you for employment. They usually charge the employer, okay, not the employee. And you can also apply directly to the recruiter. Sometimes it's rare, but sometimes they advertise, and through direct recruitment, you can come to Gulf. After application through employment portal, once accepted, data flow should be done, and they will charge for it. There will be extra charge, but again, you don't get. Sometimes they need online clinical screening via Zoom or any video conferencing. After that, negotiable contract and terms will be signed by you and by them, following which they will process your visa and flight tickets. And so this is whole structured process which is I have just summarized here. Now the reality check. While you are coming through steps of securing employment here in Gulf, please talk to your colleagues about the clinical environment, duty, workload, etc., and chance of professional growth, salary increment. Also, you need to be clear about how the limited social life you may have, how limited social circle you will have in Gulf. However, you can frequently visit India because it is not far away, just 3 to 4 hours of journey by aeroplane. And when I came to Gulf in first few years, I was frequent traveler, and then it was very easy. So one of my friend is traveling every month. His wife is in AIMS, and just delivered a baby, so he visits his family there every month. So it's quite convenient, okay. And for the ICU, because these are the shift duties, so you can just do your duties you can club your duties together, and then can get little more extra leave to visit your family in India. It's very easy actually, just 3 to 4 hours of flight. Only negative part of working in Gulf is the contractual job. So these are not permanent jobs, as you know, but usually extendable and keep you on your toe. And I have seen many people who are living here for very very long time, like 20-30 years, okay, till they die sometime, till the retirement, or till they can work. So this is a very good environment here in Gulf, very safe. You will feel safe for your family, at your workplace, everywhere. Everybody respect everyone, and nobody is abusive like in India. It's very cool here. I mean, you should definitely think of coming here. People are nice, respectful. There are few recommendations who are planning to come to Gulf. First, you should be competent. You should have a good degrees like ERIC, PDF, and PDCC after DNB. And if you have DM and DRNB, that's nothing is needed, just a degree, and then you would not be replaceable. This is the advantage. Second, there should not be any gaps in your service for more than 24 months, okay. And choose your country wisely. For example, I prefer Bahrain over Dubai because people are easy going, welcoming, and not as fast paced as in Dubai. In Dubai, you may have not, you won't be able to save much because everything is so exorbitantly expensive. Final verdict is that if you are opting for Gulf jobs, want to have good life, work balance, and safety for you and for your family. I know many of DM and MCH even who are working in Gulf countries because life is livable here and breathable here more compared to India. It is clean, and money is clean, and for your kids. So that's all for today. Thank you so much for attention. Bye bye.